Hi friends, I am Dr. Pratap Sinato. I have done MD in forensic medicine and today we'll continue with forensic psychiatry. In that we'll continue with again common conditions associated with forensic psychiatry. First of all, we'll discuss about phobia. So phobia by definition is excessive, irrational fear of an object, situation or activity. So here the person has excessive fear which is irrational. So though he may feel that he is having fear, but the way he behaves because of that fear is very irrational. It may be because of some object, he may fear of an object, a situation where he is present, or because of any activity he wants to do, he will be fearful. So phobia may develop to almost any object or situation. Common example like acrophobia, the person has fear of high places. Agoraphobia, fear of large open spaces. Nyctophobia is morbid fear of darkness. Claustrophobia, fear of staying in closed or confined spaces. Misophobia is morbid fear of filth or contamination. Or xenophobia is fear of strangers. So though these are some common examples, the others also present. So here the person has in any condition, if like example, if the person has fear of high places, in even if he stands over some bed also, he may feel the fear starting. He may feel excessively anxiety, start sweating, and may feel the fear. That is condition considered as a phobia. Next type of condition is the lucid interval. So lucid interval is a period. So it is a time period occurring in insanity during which all symptoms of insanity disappears completely. So here usually there is a period of no symptoms and period of symptoms. So lucid interval is considered as uh, the period of no symptoms. So it between two periods of symptoms, when there is no symptoms, it is considered as a lucid interval. So symptoms may be anything like in case of psychiatry, we'll discuss like symptoms of mental illness. So it is also applicable in head injury also, where the person may lose consciousness and gain consciousness for brief amount of time and again lose consciousness because of head injury. So that is the lucid interval. The period of lucid interval varies from one person to another person and from time to time in the same person also. So it is not constant in same person and also it will depend on different persons. And as such, one cannot be certain about time when the person passes again and in the state of insanity. Lucid intervals are common in case of mania conditions and melancholia conditions. They are commonly seen. Medically important lucid interval, the person is responsible for all his acts performed during the period of lucid interval. So because in between the two period of symptomless period, if he commits any crime, as I mentioned in previous videos, any person who has some symptom of mental illness, he is not responsible for his crime. So in period of lucid interval, he may if he commits any crime, he will be becomes responsible. If he commits a crime, then he will take he has to take the previous illness since he has the plea has become has mental illness. But it is very difficult to prove whether he at the time of committing a crime whether he was in lucid interval or not. Coming to next form of condition is oneroid states, also known as oneirophrenia. It is a dreamlike state in which it may last for days or weeks. The person will be in a dreamlike state. In that kind of dreamlike state, it may last for a few days to weeks. In that, person suffers from mental confusion, amnesia, that is loss of memory, illusions, which we have discussed that he has, where he interprets some object to be some false interpretation of an object, hallucination, where there is a false sense of perception of any senses, like he may see things, hear things. There is a disorientation, agitation, and anxiety are present. It is usually seen in case of a delirium and case of schizophrenia condition, diseases, it is commonly seen. Next type of condition is the twilight state, or also known as psychomotor. In this state, it is a state of diminished awareness of acts of relatively short duration, of which he has little or no subsequent memory. So, in this condition, the person suddenly loses awareness of his belongings and he doesn't have the memory of that. So, in that state, he may do any acts and patient may do some unaccustomed automatic acts, sometimes in aggressive way, and may suffer from some visual hallucination also. So in this condition, suddenly the person loses awareness of his locality or surroundings, and again he regain his awareness, and he will not have any memory that he has lost that period. So, like for example, in a day, he may for suddenly for 5 or 10 or 1 hour he may lose awareness, and after 1 hour he may start continuing the same work, but he will not have that memory that he has lost that 1 hour and he doesn't have remember whatever he has done in that condition. It is usually seen in cases of epilepsy. This twilight state is seen. Next type of condition is the hysteria. It is characterized by self-dramatization, excessive emotionality, and attention-seeking behavior. So here the person excessively considered to do self-dramatization, emotionally is excessively emotional. He wants to seek attention. Behavior is seen. He is egocentric, demanding. Inter relationship are typically of this condition. So here the person will be egocentric. He will be demanding from his partner, and that type of relationship is commonly seen in cases of hysteria. Next form of condition we'll discuss about is psychopath. So psychopath, though it's not a mental illness, is a personality disorder. It is a form of personality disorders wherein the person is neither mentally ill nor defective, but does not conform to be normal due to failure to adopt normal ethical standards of behavior in society. So here the person is though not mentally ill, doesn't have any illness, but he has some personality disorder where he cannot adapt to the social norms, ethical standards of the behavior of the society. He doesn't fit or doesn't abide by those norms. In this, there is a failure of maturation of the personality. So the person will be not mature and he retains the childlike selfishness. They have no abnormality of thought, mood, or intelligence. So though like he doesn't have delusions, he doesn't have hallucinations, he doesn't have any thought disorder of any thought or mood or disorders, but their behavior is unacceptable. So their behavior, way they behave is different. There will be lack of emotional response, an answering desire for gratification of the desire, and complete lack of consciousness, a characteristic of psychopathic personality. So they don't have any consciousness, and though whatever they do, they don't feel any type of guilt. Frustration of any whim is not tolerated and is met with aggression, complete divide of any regret or remorse. So any form of frustration they feel in their life, they cannot tolerate it, and it is usually expressed in form of aggression. Imminent violence include murder, including murder can arise from any challenges to their egotism. So any challenge to egotism may lead that they can commit a murder of any person. They can plan, implement their antisocial action in a very efficient way. The basic difference appears to be in moral rather than psychological or neurological. So, though their moral compass is very diminished or they can't differentiate between good and bad, they don't have any psychological or neurological deficit. Typical personality of a psychopath is they have normal to very high IQ or to be maybe sometimes even genius level IQ. They will be charming, impress persons externally but deceive for long time, indulging in fraud, theft, deception, and assault. So the personality in such a way that they want to deceive the person. Slow temperamental outburst, verbal and physical attacks without provocations are seen, which only feels better whenever he does that. That is typical personality of a psychopath. Medical part of psychopath, it is not a ground for any inciting defense, but may provide a plea for diminished responsibility. So since it is not a form of psychological disorder, he is not considered, he'll be responsible for any crime he's committed, but though his responsibility of offense will be diminished. Next is neurasthenia. Next condition is neurasthenia. In this condition, there is nervous exhaustion due to physical and mental conditions. So because of certain diseases, there is nerve gets condition gets exhausted. There is abnormal fatigue, irritability of the nervous system is seen. That is, the nervous system is exhausted and the person doesn't feel any kind of emotion or pain or sensation will be lost. Next is mutism. In this, there is a complete loss of speech. The person is not, the child is not able to speak. It is seen in conditions like hysteria, catatonic schizophrenia, depression, organic brain lesion, malingering, where the person may try to feign a psychiatric illness by not speaking. So, though it is also in psychiatric disorder where the child or the person will completely stop talking and lead to a silent free life. Next form of condition in psychiatry is psychosis. So psychosis is a mental disorder which is severe and characterized by withdrawal from reality and living as if in another world, a world of fantasy with delusions and hallucinations. So the person here is devoid of reality. He is withdrawal from reality and lives in a separate, feels to be living in a separate world filled with delusions of different types or hallucinations of different types. These mental illnesses supervene upon normal developmental faculty. So they usually supervene the normal mental development and they persist. There is a deterioration in the personality and progressive loss of contact with reality. So as the disease progresses, the person loses the touch with reality and continues in the fantasy world. Typical clinical features includes the patients accept all symptoms as real, reconstructs an environment of his own or her own with which he or she tries to recreate the world and claims to have strong voices and attracts followers or disciples. So here, the person, whatever he believes in the fantasy world, like delusions, hallucinations, accepts that and continues to live in that and may try to attract any followers also. He may try to pursue other persons to follow himself for any things which he believes to be true. Delusions and hallucinations are common in psychosis. Certain drugs such as alcohol, heroin, morphine, cannabis, cocaine, and LSD used habitually also produce psychosis. May also occur in conditions like epilepsy, cerebral tumor, cerebral trauma, and pregnancy and childbirth conditions. Psychosis is seen. They commonly psychosis may be organic psychosis or functional psychosis. Organic psychosis has physical psychosis present. It may be acute, as in like high fever or delirium it is seen, or chronic, as in dementia it is commonly seen. So organic is has physical cause, means a certain cause is present because of which the person goes in psychosis condition. Functional psychosis is there is a pathological variation of mood. So person there is no particular cause is not present, but because of his development, pathological mood development, he may end up in psychotic condition. Opposite to that is the neurosis. So in this, the patient suffers from emotional or intellectual disorder in which the patient does not lose touch with reality. Though the person has some illness, mentally emotional instability, and it may have intellectual disorder, but the person believes to be living in a reality. He will not lose the touch of reality. They occur mostly in the form of anxiety, depression, or hysteria. The effects may be mild, may cause considerable distress to the patient, but they are not associated with severe affective change nor with the disturbance of thought. So here the person may have some mild to moderate conditions. They are not associated with any severe conditions or any disturbance of thought. There means there is no thought disorder like delusions or hallucinations not present, but usually there is conditions of anxiety, depression will be seen. Now we can, if you look at the difference between psychosis and neurosis, as such, psychosis is a disease entity which its physical basis is present with determined genetically. So here the person maybe there may be some genetical disease or physical disease may be present. In neurosis, a reaction to stressful circumstances due to adverse childhood experience. So here the person may not have any disease or anything like that. The whatever the mental illness he has developed is because of stressful circumstances of his how his life has been present. So adverse childhood interaction, because of that he may develop neurotic symptoms. The psychosis is a major illness. It is neurosis is a minor form of illness. Empathy is absent in psychosis. Empathy is a condition where the person will not be able to empathize with the other person and may not be able to feel. It is psychosis since the person loses the touch with reality. In neurosis, there is empathy will be present. Contact with reality is absent in neuropsychosis. The person in neurosis is contact with reality is present. Insight that the person is absent in psychosis means he doesn't know what he is, where he is, whatever his insight of his own thought is absent, which is present in neurosis. Common symptoms like delusions, illusions, hallucinations are seen in psychosis. There in neurosis, usually commonly symptoms are psychic symptoms not commonly seen or seen. It is commonly seen in dementia and schizophrenia, psychosis. Neurosis is seen in anxiety, phobia, and depressions. These are my references. Thank you.